Good day. I am Alejandro Roberto Montejo, here to present a study on the quality of life of pediatric patients with femoral shaft fractures treated with plating versus elastic nailing in a tertiary government hospital from January 2017 to December 2018. Femoral shaft fractures rank among the most common traumatic injuries requiring surgical treatment in children. Most femur fractures in this age group are due to falls and vehicular accidents. Its management evolved gradually in the past decade towards operative approaches because of the desire for more rapid recovery, wherein plate fixation and nails are the main modalities of surgical intervention. There has been no local published data regarding the frequencies and demographic distribution of pediatric patients who underwent plating or elastic nailing of the femur. The study will also provide information regarding the quality of life of patients postoperatively and would serve as a springboard for the further studies and development of treatment algorithms for pediatric patients with femoral shaft fractures. General objectives: to determine the quality of life of pediatric patients who underwent plating and elastic nailing of the femoral shaft. The research study will attain several objectives. The following objectives are enumerated below. First, to determine the demographics of these patients according to age, sex, weight, mechanism of injury, duration of preoperative hospitalization, and operation performed. Next, to determine the quality of life of all patients using the PEDS-QOL in terms of physical, emotional, social, school functioning, and the total score. Lastly, to compare the mean quality of life scores of patients with femoral shaft fractures treated with plating and elastic nailing in terms of physical, emotional, social, school functioning, and the total score. The researcher utilized a two-stage retrospective, prospective cross-sectional research designed to achieve the objectives of the study. Retrospective analysis of charts was done at the medical records to determine the case that may be included in our study. The quality of life scores was done prospectively through survey questionnaires. The population of this study are composed of all patients from 6 to 13 years old treated with elastic nailing and plating of the femur. The researcher used a complete remuneration to obtain adequate population for patients under both groups separately. The patients included in this study are those admitted from January 2017 to December 2018, who sustained a simple femoral shaft fractures ages 6 to 13 years old. Patients with multiple injuries or the presence of an ipsilateral injury to the knee or leg, non-trauma femur fractures with an underlying pathologic process are excluded from the study. To be able to determine the quality of life of patients with femur shaft fractures, PEDS-QL 4.0 generic score scale questionnaire was used. The questionnaire is in English and Bisaya language and was validated by the research advisor. Patients were presented with a 23-item question and answered directly with 5 options. 8 items for physical, 5 for emotional, 5 for social, and 5 items for school. The quality of life was calculated using the PEDS-QOL tool. Each of the questions responses related to a different pre-coded numeric value and translated to raw scores. The range of subscales and overall scale is from 0 to 100, with lower scores indicating poor health-related quality of life and higher scores indicating better quality of life, in which the scores were tabulated. A total of 31 patients were operated in this institution. Out of 31 patients, 24 contacted and were included in the study. From the 24 patients, 75% were males and 75% were females. The number of patients according to weight are the following. For the mechanism of injury, majority of the patients were caused by fall. Pre-operative hospitalization were equal with 50%. Plating was done in 58.3% and 41.6% underwent elastic nailing. The quality of life parameter with the highest mean score was the social function with 95.38, followed by school function, then emotional function, and lastly, physical function with a mean score of 87.1. For the comparison of the quality of life in both groups, we use the Mann-Whitney test. We arrive at a p-value of greater than 0.05, which means that there is no significant difference in the mean quality of life in both groups. The total mean score of patients under plating was 91.69, and the total mean score of the elastic nailing group was 93.15. However, in the physical functioning, question number 8, I have low energy. Notice the p-value of 0.038 as highlighted in yellow, which is less than 0.05, implying that there is a significant difference in the mean quality of life in both groups. Other parameters show no significant difference between the plating and the elastic nailing group. In this 2-year review, 24 patients were included, with 14 patients underwent plating and 10 under elastic nailing. In this study, fractures occurred more in males than in females, with the cause of injury related to fall. Using the 4 parameters, the study noted to have a slight advantage in the elastic nailing group. There was a slightly higher total mean score of 93.15 in the elastic nailing group compared to the total mean score of the plating group with 91.69, but did not show significant difference in the mean quality of life. With this study, both surgical options, either plating or elastic nailing, may yield similar quality of life in pediatric patients with femur fractures. Plating may be offered to patients with limited financial capacities or in cases where elastic nailing is unavailable. The researcher would like to recommend future studies on other options like external fixators and continue the study in larger populations and to determine the outcome along the quality of life in these patients in a long-term basis. Thank you.